Welcome to the 905er podcast. My name is Roland Tanner.
I am Joel McLeod.
The longer the COVID-19 pandemic goes on, the more confusing it seems to be for many of us. While there's been broad consensus about the need to limit social interaction to keep the spread of the virus under control, and the vast majority of people have always been willing to do whatever is asked of them to protect themselves and others, there's far too often been confused and contradictory messaging from different levels of government. The result is that as we enter a third year of living with COVID-19, many of us feel as confused about what lies ahead as we did back in 2020. Furthermore, as the pandemic has gone on, the reasons we're staying at home have evolved, away from the easy-to-understand need to protect our own health and towards more nebulous objectives such as protecting healthcare from overload, maintaining the workforce, saving the economy, and most frustratingly, protecting those who have thus far refused to protect themselves. So to try to bring some clarity to where we are now, how the government has handled the pandemic and what we can expect over the next year or more, we invited an epidemiologist, Dr. Todd Coleman, onto the podcast. Todd Coleman received his PhD in Epidemiology and Biostatistics in 2014 from the University of Western Ontario. After his PhD studies, he worked as a postdoctoral fellow at Ryerson University, then as a Public Health Epidemiologist with the Middlesex-London Health Unit. Currently, he is an assistant professor in the Department of Health Sciences at Wilfrid Laurier University, where he teaches courses in Epidemiology and Population Health. His research focuses on issues of social inclusion and health equity.
Well, I'd like to welcome Dr. Todd Coleman to the 905er for our first, actually it's our first interview of 2022, so you have the distinguished honor of that illustrious title, I suppose. We're still in the grips of this global pandemic, and we seem to be, a lot of people, I think some people might start referring it to as the groundhog pandemic, because we kind of keep doing the same things over and over and over again. And surprise, surprise, nothing's changed. Like nothing's really changing. Like we're not getting any traction.
Right.
Maybe what was the definition of insanity? Doing the same thing over and over again and expecting a different result each time. Can you give us your take on how our public health in Ontario, from the ministry all the way down to I guess the local units, should be how would you grade them on their behavior so far 2 years into this pandemic?
Yeah, that's a good question. I'm very respectful, and I've seen quite a bit happening at the local levels in terms of the responses, the pivoting to scheduling mass vaccinations, the collecting of data, the understanding of the need for region-specific measures that need to be in place. So I'd grade them pretty high at the local level. When I move up into the ministerial level, the grade goes down a little bit, unfortunately, in terms of the policy decisions that have and are being made currently. I'm not as impressed, if we want to use those words, as what's been happening. There doesn't seem to be a lot of foresight, especially considering 2 years into this. Like you said, we're going through the motions again, another wave, and lessons learned from previous ones don't seem to be happening.
Well, right now everyone's talking Omicron. Oh, it's not as severe. It's the lighter COVID, if you will. Yeah, I mean I just want to note to our listeners, we're recording this on Thursday, the day after it was announced that on Monday we're going back to school in Ontario. So that's our context for this recording. What I had a thought that just escaped my mind there, but I'm trying to put this into words a bit here, and I'm stumbling over my own words. But at the ministry level, why are we not seeing a more proactive approach? What are you seeing that we should be doing at the ministerial level to really kind of clamp down on this and stop going through it again?
Yeah, we're in a unique position. So just first to address the Omicron and being a milder version, a lot of that has to do with the fact that we have vaccinations in these waves, high proportion of people who are vaccinated. We're still seeing in the unvaccinated severe COVID illness happening. So that we're in a different situation at that point. And to answer the next part, in terms of what we should be doing, we seem to have abandoned some of the measures that we were using in the past to help us move forward. The testing, and this is where I feel very strongly, is testing is key, right? We want to prevent illness as much as possible, and vaccinations are a great tool for that. But preventing illness also happens from people knowing whether or not they have COVID. And it's very much the fact that we don't have the capacity right now to test everybody who potentially has COVID. And we're targeting testing right now. And that's where earlier use of the rapid tests, more on the government's part in procuring rapid tests, those kinds of things really do go a long way to help prevent further infections down the chain. We're looking at chains of infection, right? So right now with the amount, we're looking at more like a web of infection because of what's happening. But the more we test, the more we know. So that's one of the main parts that was going on. I think in terms of the general, if I was to speak generally about what's happening, is there just seems to be a lack of foresight about what's happening. We're not the only province, we're not the only country that's been through this. We see other countries. We see examples from Israel where we saw a lot of evidence of vaccines losing their efficiency over time. If I was in a position of power in the government, I would have said, oh, wait, we need to start thinking quite quickly about how to launch an effective booster campaign, not dawdling along and saying, I'll wait and see what happens. We know what's going to happen. It's not a confusing situation. We're not different from other people. We're breathing air in proximity to other people. That's essentially the basics of it.
It's reassuring in some ways to hear someone who actually is qualified in the subject kind of saying what my gut feeling is that throughout this thing, everything happens 2 weeks too late. It's like we see Omicron coming most recently. Okay, well, we need to be ready for this. And then, after Christmas, suddenly the Premier stands up and says, whatever his quote was about making a decision in 30 seconds. 30 seconds after 2 weeks of kind of thinking about it.
Right.
And I just want to come back to that testing is key element, which is right now, if I were feeling sick today, I would, the current government advice is, I would then just assume that I have COVID. There's going to be no statistics about me. There's going to be no kind of official record about me, but I am to assume I have COVID, stay home. And now, I mean, it's something that I've certainly been very aware of during this whole thing is how I think this is just human nature. People rationalize things. So the number of people I've heard who have said things like, well, I have a bit of a cough at the moment, but I'm sure I know it's not COVID because of something which tells us absolutely nothing. Or, I had contact with someone who had a cough, but I'm sure that's human nature. Without that testing element, you're reliant on people's kind of judgment of what they have, which is notoriously poor.
Right.
So, I mean, is there any excuse at this stage for saying, well, we don't have the capacity to test for everybody, so let's just give up? I mean, is that excusable, or do you think it's just a matter of they should have put more money into more testing?
No, it's not. It's not excusable. The basis for any public health action is based on data, and if we don't have the data to tell us what we're looking at, we can make estimates all we want, looking at the way that cases are now, but it's not really that excusable. Is the basis of any public health action is based on having accurate data, and right now we don't have that.
I mean, another element of all this throughout this whole throughout COVID is I mean, I felt that kind of lack of reliable data, and to an extent, I mean, in Canada we have very strict privacy rules, which is a good thing by and large.
Yeah.
But also, the rules are so strict that things like, I mean, I actually did this. There are statistics out there now on what percentage of people in an ICU are unvaccinated versus. And then people immediately misunderstand those statistics because they say, well, there's more people in ICU who are vaccinated. And it's like, well, that's just bad math on your part. That's not the vaccine not working. And however, that kind of reluctance to say where the disease was spreading most, where the things that are the bread and butter of your job, I presume, of how spread happens, where it happens. In fact, just for anybody who's listening who doesn't actually know what an epidemiologist is, perhaps just sort of go over what you are and what distinguishes you from another kind of doctor. In fact, just because it's one of those words that people throw out there that we're all meant to understand now, and don't necessarily.
Yeah, it's a good question. So, an epidemiologist, in very, very basic, is someone who studies epidemics. So it's basically the study of the causes and the distributions of disease in a population, is what it really boils down to, and also understanding how to control and to change those distributions.
I want to jump in on that note there. Your job as an epidemiologist, you rely a lot on public data. The statistics of hospitalizations and whatnot to kind of build models, analyze the status quo, et cetera. What's your take on? I mean, I was looking on online just before we logged on here, and the Minister of Education was saying that they're going to not notify parents of any COVID hospitalizations or any COVID cases. Forget hospitalizations, just cases of COVID in public schools. Unless it's 30%, not even of COVID, just 30% absenteeism in the school. Can you tell us a little bit? I know a lot of parents are concerned about that, just from their own sense of well-being. Can you tell me how does that impact your job in terms of taking that data and saying, how prevalent COVID is in the school system, or just maybe in public, in a public neighborhood or in a city at large? How does that impact your work?
That impacts the work very, very, very clearly. We always have to. The other component of what we look at is assessment of the data and whether or not we can reliably think that it's accurate or not, or a true reflection of what's happening. It's never been perfect. Case assessment. It's never captured the entirety of people who have had COVID. But with the generalized testing that was happening and the availability of testing, it was relatively accurate. Now, withholding information, when we're talking about the absenteeism, there's a couple of things that came to mind for me for that. When I was listening to the conference that was happening yesterday, the media conference, and Dr. Moore was suggesting that this was based on the 30% absenteeism, that threshold is based on other respiratory illnesses in the past. That was what they were using for others in schools and classrooms. Now, to me, that immediately struck something in my head, because number one, while COVID is transmitted largely through respiratory, while it's airborne, it manifests in different ways than other respiratory viruses. It can settle in different parts of your body. We've seen evidence of that over and over again. And the other thing is, this is much more severe than the flu. It's much more severe than the common cold. and using a threshold of another respiratory virus it just seems really misguided. And I feel as if parents should have a little more information available to them to make the decisions to keep their families healthy.
So just a quick follow-up. So your job as an epidemiologist is to build models of presumably future waves, which I think at this point we're all assuming there's going to be a future variant of some sort coming down the pipeline. That's the way this seems to be working out at the moment. You need to build this a potential future model. I'm going to assume, correct me if I'm wrong, but based on the kind of the previous waves data, to say, okay, this is what we learned from the last one. We're going to infer that this is going to happen given this data. We're going to infer this might happen down the road. Does this lack of data reporting on the ministry, on the provincial government side, is this going to impede our future models? Is this going to impede our way to predict the severity of future waves coming down the road?
There is potential for that. The good thing is there are other jurisdictions in other countries that do reliably report data. So we have models from other countries to reliably predict what we're going to see in our context. I would think and I would hope that we would have more accurate data in Ontario to help us make these decisions and guide our decision making. But unfortunately, it's just been left so long that we can't have that right now. We're relying on you've probably heard the term lagging indicators. So people being hospitalized for COVID, people being admitted to ICU for COVID, and seeing those trajectories and saying, okay, that seems to match what the case rise looks like.
Changing direction a little bit, what do you think? I mean, what would be your best estimate? And I'm sure this is a very unscientific and an unfair question in some ways, but I mean, the governments at all levels keep on talking about, plans to reopen up, and they're still talking about, when we get back to normal, when this is over. Do we now have to stop talking in those kinds of terms and rather talk about, I don't know, a more positive sort of spin to put on it, but getting to a place where we live with COVID in a different way, where we're rather than kind of telling people what's ultimately seems to me to be at this point a little bit of a lie, that one day this will be over, that this is the plan for living with COVID for the next 20 years. I heard the other day that the UK has a kind of they're now talking in 6 years ahead of this pandemic, and I guess at some point we'll stop calling it a pandemic and call it whatever, it's just a disease that's just in the population forever, and that's just like flu or whatever. So what do you think that might look like, and what do you think the politicians should perhaps be, how should they be, I don't want to say spinning it, but how should they be explaining this to the public now in a way that might be more reflective of reality that we're going to be dealing with in 6 months, a year, 2 years?
Well, ideally, we would have long-term plans in place to understand and to see the proactive steps that are being taken to understand that it's going to be circulating for a while. Like this it's not the 2-week thing that we thought in February of 2020. It's circulating. But the thing is, we're in a very different spot right now. So we do have the tools to minimize the severity. There's a number of things that I wish we could see on the part of the government. A very solid line about the protective effects of vaccination. Don't use language like what was used in yesterday's press conference about the vaccine being new. 10 billion people have taken it. It's not new at this point. So highlighting and educating the public on what this could look like with a really high vaccination rate is great. Setting up the infrastructure, this is for me as someone who's in understanding healthcare and an epidemiologist, I want to understand the public health efforts. Are you going to be funding public health initiatives to ensure that we're not left in a place where, for example, your entire public health staff is forced to pivot into something like COVID? Because not everybody has COVID. And we need to be thinking about the general health of the population. And unfortunately, our public health system has been so stretched that we've neglected a lot of the other stuff that occurs in people's lives in terms of healthcare. I think a really solid plan, just to really bring it down to the basics, a really solid plan about information, both obtaining information and educating the public, and really having that infrastructure in place, because this could happen again. And I don't want to be left, and I don't know about you, but I don't want to live the rest of my life thinking, oh, here we go again. I get to sit in my house for another few weeks without seeing people.
So let's throw it out there. Do you think vaccine mandates work? Because I've heard, let's face it, the political discussion over vaccines is on one side say, oh, we have to educate and encourage the remaining, I think, 15% of the population to get vaccinated now. And that, I mean, it sounds like a small number. That 15% is causing a lot of damage to our way of life. I'll just bluntly say it. Mm-hmm. At this point, should we just start saying no vaccine mandates? If you want to go out in public, if you want to go into a restaurant, into a mall, into a movie theater, gym, if you just want to go out in public, you need to show some kind of vaccine passport or vaccine card or something to interact with services in the public. Are we at that, or is this a fallacy? Do they not work?
Well, it's interesting because there's a lot of misconceptions about what the vaccine does and doesn't do. You can still get COVID if you're vaccinated. We know that. In terms of the mandates, they are very effective public health tools that help prevent infectious diseases. There are a number of vaccine mandates that are currently in schools right now that prevent a number of different illnesses, and we don't see them. We know that helps. And the thing with the vaccines is the approach that was taken, and it seems to continually be taken, is that the government seems to want to vaccinate people in chunks, which is a little confusing on my part, other than vaccinating the most vulnerable in the population. They do need that protection right up front. Vaccinating, for example, the groups of 50 to 60-year-olds. Okay, that's great. Get them vaccinated, but they're also interacting with other people in the population at this point. So there should be general vaccination programs. I went on a bit of a tangent there, but the basics is that vaccine mandates do work, and we see the uptake when there are announcements made. Just look at the stuff in Quebec that happened with the cannabis and the liquor stores, with the bump in vaccination numbers that happened. Mandates do work, and they do prevent illness in the long run.
And you touched upon there the issue that has kind of been in the background from day one, which is the herd immunity aspect, which I guess we're not really looking at herd immunity because you can be vaccinated and still catch it. But I guess we're looking at herd resistance, maybe. I don't know if that's a thing. We're still, when we go through the population in sectors like that, well, Dad's got the vaccine, but little Jimmy doesn't. Each family doesn't have herd immunity, let alone the population at large. Is that the kind of problem we're dealing with there?
Yeah, I think of it as think about it as a car that's sort of running, driving uncontrollably, and there's no brakes on it. That's no vaccinations at all. When you get certain levels of vaccination in a population, you get to start pumping the brakes on these things. periods of infectiousness decrease. You end up preventing potential infections from happening and the chains from growing exponentially. These are the kinds of things I think about with vaccination, and what we're doing is by vaccinating the general population, is we get to sort of blunt a lot of these chains of transmission that are happening, and really slow this down. And this is the important thing too, is that when you slow it down, the public health system has a better chance to catch up and understand that there are the actual number of people who have COVID. They get to do their jobs efficiently. They get to do the contact tracing. They get to do the recommendations for isolation. Right now, they can't do that. They're left, and that we've got something that's flying through. The vaccinations are great right now. They are blunting things, and you can see this in the data. It's very clear in terms of the hospitalization and ICU data that vaccination is very protective against those outcomes. So, I hope that answered your question.
Yeah.
I mean, I'm going to play devil's advocate for a moment here, because
Sure.
I'm sure there's a listener listening to this episode, and they're saying, Todd, that's great. Get public health measures, all that, great. But we always have to worry about the economy. The
Right.
economy. We have to keep businesses open, and I think that this. We haven't had anyone from the government on, so I'm going to speak for them. This appears to be that they're approaching this as an either-or dilemma. You either have public health or you have an open, robust economy, and that it's okay. We'll close the economy so public health can catch up. When public health catches up, okay, well, we need to open up the economy, and then it's this yin yang equation that they're kind of trying to balance. And I think that's the question that everybody's on their minds. There's got to be a middle ground. A change of behavior, a change of expectations that we all, businesses and the public, all have to abide into, so that we can engage with each other on a social, economic level again. This kind of stop start. It's driving us all crazy. Our mental health is I got kids upstairs. I can hear them running around because they're still at home. We're all going nuts, and we're thinking there's got to be some kind of middle ground. Is that unreasonable to assume that or am I living in a fairy tale for wanting that to happen? Or is that something that we can come up with if we just kind of put our heads to the grindstone, or shoulders to the grindstone? We just work it out and say, okay, what are we willing to compromise? What are we not?
It's definitely the latter. I agree with you. The economy needs to function properly. All of these things are intertwined with each other. I think from it's not an either or thing. I think we have very, very, very strong tools at our disposal to help blunt this, to allow the economy to open up. And we're just not using them to the maximum efficiency that we could be, unfortunately. And those are vaccinations and mask mandates work. The education there, what I find is we're speaking in too many simplistic terms, right? So people say masks work. Okay, that's true, but what kinds of masks are working? And how do you wear a mask properly? Those kinds of educational components. I'm sure you both have been out in public and you've seen the people that have their masks under their nose. Mm-hmm. That does absolutely nothing to prevent.
I know. It's nearly always the older gentleman whose health you fear for the most as well.
Yeah.
Like, pull it up, dude.
And part of you wants to just wave at them and go, pull it up a little bit, just a tiny bit, so that you're covering your nose. These kinds of components we are important to distribute. Now, what ends up happening is that what I've seen, and this is we get on one course of action and one course of communication, and then all of a sudden they pivot completely, and then you're left with a whole new framework of something that you need to learn. Now, in terms of consistency, we think back to the basics. Sharing air from someone who has COVID is how this is transmitted. And those masks and blunting it with vaccines, could be very effective, but they're just not pushed as much as they could be. And I find it really disappointing that we start thinking in terms of absolutes. And this is just a function of how we think about health in general. We get sick, we take a pill, it's better. It's not as simple as that. We want to prevent these infections in the first place, and these are the best tools that we can.
Is that maybe the problem here? Is that it's the solutions are fairly simple to prevent the spread of the pandemic. It's just kind of like a reminder of change your behavior, like you said, wear your mask properly, go get a vaccine, etc. And that's not really you don't get like the dramatic finish, right? You don't get to make like the big hurrah speech at the end. It's just, wear your mask, folks, like wear it properly and go get a vaccine. If you want to go to grab a beer with a buddy, that kind of thing. Is that just it? Like, is that like we just don't have the imagination to conceive of something so simple to really do, like to like just the simple and the persistence of that behavior.
That's right.
Is what it matters.
Yeah, it is. That's it. The persistence of that, and people like there's misconceptions because people. I'll use the examples with the vaccines that we thought that 2 would be enough, and then we would be done. So we'd get our 2 doses and we'd be done. This behaves a lot more like something like the flu shot that we have to get every year. So pivoting and making sure that people understand that it's not that things do change, and the scientific process is with more information, and as time goes on, we understand more about what we need to do to prevent everything in the first place.
Coming back to another point you just made a few minutes ago, and you were saying about wear masks, but also don't be so simplistic in terms of explaining to people what the best masks are, how to wear the masks. What is the best mask? I mean, I know with Omicron, my mask habits have changed. I'd been out and bought some from I bought like permanent washable ones fairly recently. Before that, I've been going paper all the way. I thought, I'm sick of these things. I'm throwing things in the garbage, and sick of how many paper masks I walk past on the street. I'll get a permanent one.
Yeah.
Then it's like, I'm not sure I trust this thing to protect me from anything. So now I'm back to paper. What would be your advice to people looking for a good mask option? I mean, is it N95 or bust, or is there more to it?
With the transmissibility of Omicron being so high, the N95s are probably they are the best protection, as well as they prevent you from passing it on to someone else in case you do have it. Yeah.
And is I was just thinking, my mother grew up in the Second World War. I'm presuming within the first year of that war, everybody in the country had been given a gas. She was in the UK. Everybody had been given a government-issued, paid-for gas mask. Why on earth isn't the government handing these things out to people?
It's a good question. I've heard of other countries proposing this. It's costly, obviously, to send everybody, 35 million people, an N95, but could go a long way.
I mean, it seems compared with other things that the government does pay for all of us, garbage collection or whatever. I mean, it's all covered in the tax ultimately, but whatever. It would be affordable. I mean, sure, they don't last forever, so I get that. But I mean, even if they're, Anyway, it just literally struck me while we were talking. It's like, hang on a minute, I'm sure my mother didn't go out at the age of 7 and buy a gas mask.
Yeah. She would have been very proactive. You're absolutely right. So if you think about it in absolute, this is where I talk about, and you brought it up in terms of long-term thinking. So this N95 could be the difference in the next few months in hospitalizations and ICU costs. Like, I'm sure that the cost benefit analysis would probably be in the positive if you were to send out some like those masks in terms of the eventual healthcare costs of not using those, or
So that's an interesting point. And again, I think as a society we've become so unambitious in what we expect of government that I'm not aware of that question having really been asked before. It's like, people talk now about, feminine hygiene products. Why do women have to pay for these things when they're essential? And that's starting to be, I think Scotland has passed legislation so that they're free now. I think Hamilton's doing something about that as well. This seems very much on the same sort of pathway. And I guess, we're sort of drawing towards the end here now, and I was just wondering what advice you would give to people to extent like myself who are so sick and tired. I think, that's the overwhelming kind of feeling I get now of the population is most of us, we've tried to do everything right. We've tried to do what we're asked. We've really, most of us are not questioning. Most of us got the vaccine as soon as we could. Most of us have stayed home. And it's like, there's no reward. All we're getting is more punishment. It's kind of how it can feel. I'm not saying it's right. I'm just saying how it can feel. What kind of advice would you give to those people now about, sticking with it, or the best approach to protect yourself and your family without actually going loopy from lack of social interaction?
That's there's a few things that I would suggest. Stick with it, like you said. There are benefits to what we're doing in terms of isolation, mask wearing, all of that stuff, physical distancing, and so on. The other thing too is I strongly urge people to really voice that they're tired to their elected officials, that they're tired of this. A lot of this is poor planning on the larger government's part, and lack of foresight. These aren't confusing things at this point. We're 2 years in, we know how it works, and we know what prevents this, and allows us to stabilize this system, and they're continually ignoring what could be done to make this quite simple, and really pressuring your elected officials, whether that's at the regional level or the provincial level. Really making that heard is an important thing, because at this point they're the ones who are making the calls in terms of what we're doing and what we're not doing.
Well, I think we'll leave it at that note for this episode. So I'm going to say thank you to Todd Coleman, epidemiologist, expert. He's the guy who actually puts all the stuff on Google for when you do your own research. You're reading him, so listen to him today, folks. But thank you very much, Todd, for coming on, sharing your expertise with us, and filling in some of the questions that Roland and I had on the mess that is COVID-19. So thank you very much for your time.
Thank you. I appreciate it.
Thanks.
That's it for this episode of the 905er. Thank you for listening. As always, you can send us your feedback, thoughts, and concerns, or ideas for future episodes to our email, info@905er.ca. We'd love to hear from you. You can help us keep the 905er going by financially supporting us through Patreon as well as PayPal. Visit us at 905er.ca and click on the support tab. As well, links are in the show notes for your convenience. Lastly, you can find us on social media. Search for _905er on Facebook, Twitter, Instagram, and LinkedIn. So long for now. See you next time.
You looking to make the most out of this life and optimize your personal wellness? Then check out the Natural Man Podcast. Join me, host Mike C., as we explore all areas of human wellness, physical, mental, and emotional. Learn strategies to optimize your own well-being and be in the driver's seat of your own health. Remember, your doctor works for you. Learn biohacks, neurohacks, ways to improve sleep, and ways to optimize your body and your mind. Check us out on Apple, Spotify, the Fountain app, and at naturalmanpodcast.com.